Dr. Frank Lanzasera of Total Regenerative Therapy sees a wide variety of conditions, and today he's back to explain how it is helping with a common thyroid condition. This, you say, actually is what started stem cell therapy for you. Good morning. Good to see you, Doctor.
Good morning, Carly. Good morning.
So let's dive into this. We're talking about Hashimoto's disease, which all I really know of it is that it's kind of hard and difficult to diagnose.
Right. Well, chronic hypothyroid. Most chronic hypothyroid is Hashimoto's autoimmune thyroid. It's an autoimmune disease, and it affects about 80% of hypothyroid sufferers. It's the #1 reason why women feel lousy on a day-to-day basis.
That's crazy. So again, I want to go back to this is where it all started for you, and looking at stem cell therapy and looking at maybe some alternative ways to treat it.
Right. So most patients with Hashimoto's hypothyroid, they need their thyroid medication, but they need more help.
Okay.
So it's real important to help balance and calm the immune system in these cases. And we do that with dietary manipulation, doing food sensitivity testing, because food sensitivities can be a trigger for certain autoimmune conditions. But I brought stem cell therapy to the table because stem cells are very powerful at calming and balancing the immune system, which these patients need.
And that's what I want to hear about these patients. What's the response been like?
So the response has been great. A lot of them have chronic brain fog, chronic fatigue, joint pains, and bringing stem cell therapy to the table for them helps address those chronic symptoms.
Well, and what's important here is you're not saying that, listen, you get rid of the medication. I mean, this is something that you look at as well. It's part of the bigger picture.
Right. No, these patients need their medication. In fact, our nurse practitioner will sometimes prescribe bioidentical or thyroid hormones if the patients aren't under the care of another practitioner who's already doing that for them.
What if someone is just on the beginning of their journey, of women particularly figuring out what is going on? Do they have to have, it already diagnosed before they come and see you? Can they come to you to get it diagnosed to see if this is what's going on?
Yes, they can, but most of our patients have already been diagnosed as hypothyroid maybe 10, 15 years prior. But despite the best medications, they continue to have symptoms because the autoimmune component of the condition has not been diagnosed. And it's a simple blood test to diagnose Hashimoto's, and sometimes using thyroid ultrasound, which is very easy to do.
How long do the treatments with stem cell therapy, if someone is going to be doing this along with their medication, what does that look like?
So we just had a patient with Hashimoto's. She's been on her medication for a decade, but still chronic fatigue and a lot of joint pain. She had one stem cell therapy treatment a month ago, and her chronic fatigue is gone, her joint pain is clearing up. And
so how long will that last, do you think?
That could last indefinitely for her.
Just the one?
Just the one. But we're also with her, because she's autoimmune, she has Hashimoto's. We're doing some dietary intervention and some supplementation to also help balance the immune system.
As people are watching this morning, and again, I think, as I'm learning more about it, it really does look like this is the future of kind of where this is going, healthcare as well. What do you want people to know about stem cell? We're just scratching the surface on what it can be used.
We're just scratching the surface, but all of us are seeing tremendous results. Now, there's no one treatment that has results 100% of the time, but the results we're seeing with some of these autoimmune cases is tremendous.
Autoimmune, though, and then what are some other things that are helping?
Well, just chronic garden variety degenerative arthritis of hips, shoulders, knees, ankles are responding very nicely.
If someone's watching today, they want to hear more about maybe what you can do for them, what would you have them do? How does the process work?
Well, call the office, set a consultation. For viewers of Morning Blend, there's a free consultation. They can go to betterstemcells.com for more information, and seminars we have around the Tampa Bay area and Celebration.
Well, again, there's the info right there. Doctor, thank you so much. We know you're a busy man. We appreciate your time this morning, and we look forward to seeing you again soon.
Thank you.